Mr. Deputy Speaker, sir, thank you for the opportunity given to participate in this motion brought by Honorable MLA Shri Renington L. Tongkhar on the topic that this House do now discuss the need to provide comfort care treatment facilities to patients in the government hospitals. When we talk of this topic, our mind is always drawn, and in fact, it is related to the cases where they are terminally ill or cases where the treatment possibilities of a cure is not possible anymore. I will give an example of what usually happens in the hospital. Now, if the patient is seriously ill, or a cancer patient that is really suffering, what happens in our government hospital is, after a few days of treatment, the advice at best that we give to the patient parties is that we cannot give any further treatment here in our center. You take the patient home, or you take the patient to any private hospitals that you wish to take. That is the advice that we give. So in participating in this motion, I also feel like the honorable member. In fact, he became emotional also. Maybe he has experienced cases where personally he encountered the situation. I'm not an expert on this, but then as a medical doctor, I can share my views. When we talk of palliative care, this is the treatment that we give to patients that has no hope of recovery, but we give treatment to relieve their pain or to reduce the symptoms. With the passing of time, a patient of cancer or maybe any other chronic illnesses, if we tell the patient to go back home, I also subscribe to the views that the honorable member has mentioned. Patients go through the stages, the different stages of pain. In the beginning, they try to bear it. Then they start crying. Then they start rolling in their beds. Then they find it difficult to eat, especially in cases of cancer in the esophagus. In those cases, especially when the patients are very poor, they cannot even go and call any doctor to come and visit home because of the involved expenditure of bringing the doctor home. So they are left with just seeing the patient, maybe it could be a father or a mother, writhing in pain, crying. The only thing they can do is look till the end time. So in this case, maybe I would like to suggest to the government to form an advocacy group. Just like we have the medical board to certify that such and such person is having a disability, we can form a similar group where maybe a medical specialist can sit in that group, a surgeon can sit in that group, a doctor with experiences, maybe a retired doctor, where after looking at the results of the investigations, can as a group declare this patient will have no other improvement, even if you go to any place of the treatment. This will save a lot of money to the respective families. I have seen so many cases where doctors do not communicate clearly because they feel, how can I say that this case has become hopeless? Because medical treatment is not like mathematics. 2 plus 2 is 4. Sometimes the treatment that we give to one patient, the patient responds very well. The same disease to on another person, same treatment is given, but the response is different. So, I can understand the dilemma of the doctors also to declare that this particular case is a hopeless case. But if there is an advocacy group that explains the prognosis or the cause of the disease, maybe if a case of cancer, if it is a 3rd stage, we should be frank with the patient parties. We should be able to tell them that the treatment prognosis is not very bright, or maybe there is no hope. If we tell the truth, what are the consequences? The family members will be prevented from selling their lands, because I've seen many families who has gone completely bankrupt. Because why? The father got cancer, they don't get the correct communication from the doctors, no proper guidance, they sell their land, they sell their vehicles, they sell everything. At the end of all the expenditure, the patient dies. And all the family members who are surviving, their life become miserable without the disease. They go into depression, so on and so forth. So, an advocacy group, maybe usually in the district hospitals we don't have the advanced care, maybe at least in the civil hospital, Shillong, advocacy group in Tura Civil Hospital, advocacy group in Jawai Civil Hospital, where that group can study the results and investigations done on the patients and tell them frankly the prognosis. In that way, the patient parties or the families will not feel guilty even if they don't try to take him outside the state. I've seen in many instances, sons and daughters come together not knowing that this case is hopeless. They spend all their earnings only to be told at the end that nothing can be done. I don't blame the nursing homes. I have seen many cases where a patient will be taken into the ICU. First day, second day, third day. It is very easy for the doctors as a team to decide whether hope is there or not. But no one will take that initiative. At the end of 15 days, the hospital bill comes to 15 lakhs and the patient is still unconscious. So I feel that is not fair. So if we have that advocacy group, when a patient is very ill but conscious, many advices could be given to that patient. For example, a terminally ill, chronically ill cancer patients, if there is a group that advises on the social aspect, that is the time, if he has not made a will, he can be advised to make a will, especially if he is a rich person. We have seen many instances in and around Shillong where family members, when the father dies, they go and fight for the properties. But from the beginning of the illness till the death of that patient, sometimes 2 years' times have lapsed. Sometimes maybe 6 months. But that 6 months was very crucial if someone had advised how to do with the wealth and properties of that person who is sick. Now, in case of comfort care, sometimes patients are sent back home with Ryle's tube or the feeding tube from the nose. Patient parties are advised you can feed them. They have been explained. Liquid food, this is how you do it. But then sometimes proper information is not given to them, that after a certain number of days, that Ryle's tube or the feeding tube has to be changed. Or maybe in between, if the patient vomits, how to handle that situation. So, counseling, telling the patients the exact prognosis, how this case will happen, or what will be the end of this patient, that is very important. Personally also, I feel sometimes very difficult to tell the patients who is seriously ill. I have come across many instances where patient party come and call me to go to their house and visit. And when I find that the patient has no hope, alone I feel it is a pain to tell them that this case is hopeless. Even I had the tendency to refer the case. But as a team, different minds, 2-3 doctors sitting together, we can give the right direction to the patient parties. I didn't get a chance to check how they do it in other developed states or countries. But maybe our government, through the health department, we can go in that line of forming an advocacy group. With that first step, maybe, that group can advise the government also what things has to be done. There is an urgent need now where we should have a hospital to treat only the terminally ill. Just like we have the old age homes, they go to the old age home, the criteria is that they are having an old age, not because they are sick. So if we have some sort of a home where people can go and that center can give counseling, spiritual counseling as rightly mentioned by the honorable member. If I talk about the spirituality of our lives, sometimes I used to tell my friends, those who get cancer in the stomach or in the throat are lucky people, because they know that they have time. If they are not living a life that is in accordance, that is pleasing to God, that is the time they correct their life. If they have hurt their friends, that is the time they call. Means they can correct their life. But I don't say that those who get cancer are blessed. A disease is a disease. But how we move from here forwards, we should be able to relieve the pain and the suffering of our fellow citizens in Meghalaya who are suffering from terminal illnesses. Let us find a way to relieve their pain. With these few words, I hope the government, considering the points given by many other members, will come up with maybe a pilot project for the state, so that people will benefit out of what the health department is providing. Thank you, Mr. Deputy Speaker, sir.